Hello everybody, welcome to Whiteboard with Merhi in 3 minutes. Today we're going to talk about a topic that's extremely common. It's endometriosis, and the title is up to 50% of infertile women have endometriosis. Now, we're going to divide it into two parts. In part 2, we're going to talk about the treatment. But today, we're going to talk about causes, symptoms, and diagnosis of endometriosis. Now we have a couple, Samantha and Steve. They've been trying for over a year to get pregnant, and it's not working. So they went to a doctor, and Samantha was told that you need a surgery to check to see if you have endometriosis. And she came to us for a second opinion. Now let's talk a little bit about what could cause endometriosis. This is the uterus. It has two parts. It has the muscle, the black, and then it has the red part, which is the lining. The lining of the uterus is what responds to the hormones, the monthly hormone changes, and what sheds to come out and make a period. However, in certain situations, and especially in women, where with the uterus we call it retroverted, meaning it's backwards, this tissue can go back into the tubes. Instead of coming out, some of it will sit on the ovaries to make cysts called endometriomas, and the other can sit here inside the vagina, on the bowel. But guess what? Once this tissue is sitting in other tissue inside the belly, it still responds to the hormones, right? The fluctuation. That's why the pain will be very cyclical and usually tend to increase just before the period, and gets much worse when women have a period, and sometimes can't go to work. This is how severe it could be. Not only that, it also can cause pain on intercourse, because see, it's sitting here outside the vagina, sometimes it causes on the bladder. So the endometriosis tissue can be anywhere. It even can reach to the lungs, believe it or not. So we need to first see if the endometriosis is what causing Samantha's infertility. How does it cause infertility? One is, if this tissue stuck here, it can block Samantha's fallopian tubes. We do an X-ray of the tube, and if they're open, that's great. Two, we do an ultrasound to see if there's any cysts inside the ovaries. We call them endometrioma. We can see them on regular ultrasound. Those, depends on the size, might or might not need resection. But guess what? If Samantha doesn't have any of these symptoms, if her tubes are open, and if she doesn't have cysts on the ovaries that indicate she might have endometriosis, then guess what? She might not need surgery to check for endometriosis, because we always assume that up to 50% of infertile women have endometriosis. And once I tell Samantha that you do not need surgery, guess what? Samantha, Steve, and I, we're going to be extremely, extremely happy.